Dear participants, it is my utmost honor to welcome you today to this International Childhood Cancer Day event, focusing on childhood cancer survivorship in Europe. Please let me use this opportunity to already thank both SIOP and CCI for organizing this important event and for giving me the honor to host it. As it is every year, the International Childhood Cancer Day is an opportunity to foster exchange between all stakeholders active in the childhood cancer field and for everyone linked to EU initiatives to get together. So I'm happy to see as many as you today in person. The fight against cancer has been front and center during this European term. Of course, thanks to the European Commission, President von der Leyen and Commissioner Kyriakides, but also thanks to ongoing pressure from the European Parliament. In this fight against cancer, I've always advocated for a 360-degree approach, in which we focus on all different phases of the disease. Childhood and adolescent cancers deserve special attention in this approach. They are faced with the disease at a very specific moment in their lives and are faced with unique questions, both medically, psychologically, and personal. The BECA resolution we adopted last year already have a huge amount of calls to action, priorities and projects, especially on childhood cancer and survivorship. Now it's time to deliver on our ambitions. We all believe the EU can and must do more in the fight against cancer and for children, youngsters, their families and caregivers. So I look forward to hearing your expert opinion today. Thank you very much. And now I want to give the floor to Mr. Carmelo Rizari, SIOP President. Thank you.
Thank you very much for hosting this meeting this year. This is a meeting which is ongoing since several years. And I wanted to welcome all the participants on behalf of the pediatric oncology community, which is not only physicians, it's made of nurses, psychologists, technicians, and obviously with the help of the great help of CCI Europe, parents, survivors, and patients. More than 2,300 members have our membership, and it's a great honor for me to have the politics sitting close to us, because in the past SIOP Europe has felt the closeness of the MEPs from different parties, from different countries. This is what is great in our field. Everyone is cooperating to beat our great enemy, which is not a party, which is not an enemy, is the cancer, is the pediatric cancer, is our enemy. I just wanted to look at the agenda with you. This is a very important agenda, because there will be parents, stakeholders, physicians, politicians talking about a great problem, which is the future of our children. Our children. These are not our patients. This is our children, and what is expecting them after the cure. We want to cure more, but we want also to cure better. I think that the future is how to translate the cure to the adulthood, how to cope the people coming from the adult oncology field to work together with us for the future. And the politicians have helped us a lot with the Beating Cancer Plan, with the Cancer Mission Board. We have one of our board members part of them, and I think this is great work which has been done. And now pediatric oncology is in the agenda of the European Union. So I think Cindy Frassen and the other MEPs who will be today working with us on this topic, which is survivorship, so the future of our children. And I wish to thank all of you for the presence, and I will give the floor to Mrs. Anita Kinesberger on behalf of CCI Europe. Thank you very much.
Good afternoon, everyone. All those who are in the room and all those who are virtually participating in this event. Unfortunately, I have to say we are today not represented as many as we are normally, because there is another event ongoing in Brussels and there are 60 survivors and parents and healthcare professionals, and we work on our new project, UKAIS, where Karina Schneider will then tell you more about that. But for us today, it is a very, very important topic, as you can imagine, because it's really, really to our heart that we had since 15 years, we really try to find out the unmet needs and all this what is missing after surviving childhood cancer. So we tried with focus groups, interviews, having really intense contact to those survivors who really survived childhood cancer. And we know a lot, and this is also what we wanted to share with you today, that we have a great, great knowledge, and really want to thank also Cindy for her introduction. It has to be done, and we are very, very, we take this opportunity with all these new calls and projects where we really can deliver and letting people know that there are changes in future. So I wish us all, looking forward to the discussion as well, and thanks for coming.
Thank you. So my name is Pam Cairns. I'm the past president of SIOP Europe, and it's my honour to chair, introduce the speakers and also chair the debate later on. And I just want to start, first of all, by saying a big thank you to Cindy Franson for hosting this event. The topic of childhood cancer survivorship is incredibly important, as you've heard from our introductory speakers. So it's great to have an entire event dedicated to this particular topic. And to start, we have a video address from Lucas Forlas, who's an MEP from Cyprus. And MEP Forlas has been a really big champion for childhood cancer for many years. He's spoken up on our behalf on many an occasion at the European Parliament, and he actually co-chairs the MEPs Against Cancer, MEPs Against Cancer group. And he's been a really active member of the Beating Cancer Committee, advocating very much on behalf of childhood cancer. So it needs no further introduction from me. Let's hear the words from MEP Forlas.
Good evening to everyone. I'm pleased to be joining you today, even with a video message. Childhood cancer affects thousands of children and their families each year. The European Parliament, through Beating Cancer Committee, has accomplished its mission, and we are very proud of delivering a concrete report. Europe's Beating Cancer Plan is putting childhood cancer at the center with specific policy actions and research efforts, from prevention via treatment to survivorship. Childhood cancer is a complex and difficult disease to treat. It is important to have a European health data space to share health data across Europe. This aims to facilitate doctors and patients' communication in every single country in the European Union. EU health data space is impossible without the trust of the citizens. Our role is to raise awareness and inform people about the importance of sharing data for research purposes. Research saves lives. Early diagnosis can often increase the chances of successful cancer treatment. Children also need special attention, which requires a dedicated, well-trained team and a special environment. Childhood cancer requires specialized care and treatments that can be expensive and difficult to access. Unfortunately, many children with cancer do not have access to the care they need. We must do more to support children and families affected by childhood cancer. We must ensure that they have access to the best possible care and treatment and tackle inequalities across the European Union. Another important issue that we need to address is the right to be forgotten, to combat discrimination and stigma. It is unacceptable that still today those young survivors with a history of cancer face social and financial challenges and limited access to loans. With Europe's Beating Cancer Plan, the approach to cancer is ambitious, from prevention to survivorship. The right to be forgotten is one such issue on which we are dedicated to bring positive change. At the same time, Cancer Survivor Smart Card aims to improve the quality of life and health status of cancer survivors. This digital tool will address the needs and support the cancer survivors through their life journey. Before concluding, I would like to share something important to me with you. I have the honor to be the initiator of the Little Heroes non-profit organization, which supports families and their children who travel abroad for cancer treatments. The last thing that these families should have on their minds is how to cover the expenses. At that point, I would like to thank all the volunteers and the people who support us all these years. The first step to any change is to raise awareness. Therefore, I would like to thank you for raising awareness on such an important issue. Together, we can make a difference in the fight against childhood cancer.
Thank you. So as Luca said, together we can make a difference. And so I'm really honoured to be able to introduce the next session, which is to hear from the people really at the cutting edge of the work for childhood cancer survivorship and how we shift from the SIOP Europe strategy through to the European Beating Cancer Plan and EU for Health. And we've got two talks, and I'm going to start by introducing the first speaker, who is Professor Katrien Scheinemann. Katrien is a member of SIOP Europe board, but is also the chair of PanCare, and recently also became chair of the SIOP Brain Tumour Group. And I'm delighted to hear from you.
Thank you very much, Pam. So it's a pleasure for me to give a little bit more detailed information about the topic today. Can I have my first slide, please? So overall, maybe childhood cancer has been a success story, because 50 years ago, it was a deadly disease. And then, as you can see here, in the 60s or 70s, we really have to start collaborate, not only on an institutional or national level, but also internationally. And you see how these numbers are rising, and they're still rising, but not as steep as they are. So for the first decades, we have really focused on survival. We needed the kids and the adolescents to survive. Today, survival alone is really not good enough. It's also the quality of survival. And looking at these graphs now, you can speculate when we introduced the idea of survivorship. And it has been a very, very long time ago, already in 1974. So at a time where not a lot of children and adolescents survived their cancer, this concept was introduced because one wise man, Giulio D'Angelo, said, we will have long-term sequelae from the disease itself and the treatment. So the concept of survivorship was born. What does this mean now in numbers? 4 out of 5 childhood and adolescent cancer patients will survive 5 years. But that's not exactly the same number within Europe. And as you can imagine, that's not true for most parts of the world. We estimate that currently 300,000 survivors of childhood and adolescent cancer living within Europe. And as you can see down, that's estimated or anticipated that it's up to 750,000 in 2030. And hopefully this number will really rise each year. But what is the downside of this success story? Most likely 2/3 of them will have early or late occurring complications due to the treatment and the disease. And 1/4 of them are even severe or life-threatening. So there is a lot for us really to do. And how are we going to tackle this? How can we improve quality of survival, which is a strategy from SIOP, but also part of the EU Cancer Plan? We need standardized surveillance guidelines so that we know if you had the exposure to this and this treatment, so this surgery, this chemotherapy, or this radiation dose, what organs can be affected and what you have to do for that. And that's like really a huge effort, and it's an international effort. And as you can see, that's not done once. We have to really look at this years and years and years, because each week we have new evidence and we have to implement this. A big theme, as we all discussed yesterday, also at the EU Cancer Conference for the survivors, is the transition from pediatric to adult care. Because looking at the numbers, they all should become adults and at some point be really like our patients, and we keep them long, but at some point the pediatric oncologist is not the right person to take care of this. But what our job is to provide them with a so-called survivorship care plan, meaning that they get a condensed summary of all the treatment they have received. And then this is translated into surveillance guidelines. And we have to educate not only our community, but especially the adult community, what this means, how then the follow-up care looks like. And as a last point, and that's not really future, but that's reality already, it's not just all the things we know. So radiation therapy, chemotherapy, now it's also all the novel therapies. And there we don't have a lot of learning to do, and really to develop how we prospectively, immediately can collect this data, learn from them, and translate them how to follow up the survivors. And with this, I would like to hand over to Karina Schneider from CCI Europe.
That's a long walk from over there.
Thank you very much, Katrin. So I think, yeah, thank you. And we can stay here for a while. So we heard yesterday and the day before yesterday, for those maybe who attended virtually or in person at the Young Survivors Conference that was organized by DGRTD, very impressively from many survivors who attended these events from our networks, what the current gaps are, what the needs are. We discussed inequalities a lot, inequalities between countries, inequalities within countries when it comes to quality of life, quality of survival, mental health, a big issue, the lack of information about late effects, about follow-up care, equality, diversity, and inclusion, one very important topic as well, education and careers. So the list is long, as we all know. And what also we saw, things haven't changed much in this regard. So we know that there are right now so many incredible initiatives going on. The EU put cancer and also childhood cancer and survivorship on the top of their agenda. And this is one of the best things that could happen to our community, because with this comes so many opportunities to develop projects where we know, where we can, as patient organizations, as patient advocates, contribute and really put the finger on the needs that are not met yet. I think one of the biggest challenges that we will face in the upcoming years is implementation of all these things that we are developing now together. Because we know that the European Union has it on the top of their agenda, but I think we need to ask the question, or maybe we don't, maybe we know the answer, at least for some, that many member states do not have it on the top of their agenda. So unfortunately, I think the message also here today is, as long as we will not manage in the upcoming years to implement all of these projects and so we have PanCare follow-up, PanCare Surpass about the survivorship passport. Now we will have the smart card. We are working on EU CAIASnet. So if we don't manage to implement these amazing programs and initiatives, survivors will just not benefit of what the European Union offers. And this is the challenge that we will face, and we need to make sure to make it happen. And so we know we have inequalities across countries, but also within countries. We need to think about why is that? So treatment centers in the countries where we have more than one treatment center, which are quite many countries, treatment centers must collaborate better and harmonize what they are doing. They also must work and collaborate better with the patient organizations. I was asked yesterday at the Young Survivors Conference by one member of the Cancer Mission Board, do you patient organizations work together in order to, like make some impact and pressure? The answer is yes, we do. We have been doing for many, many years. But I think the question is, how do we work together on the national levels as patient organizations with the healthcare professionals who are within their country collaborating, and then basically from both sides, from the EU side and from the national side, put some pressure so that also our member states will put cancer, pediatric cancer survivorship on the top of their agendas, putting it into their national cancer plans, so that these things that we are all developing and investing money and brain power in will be implemented and benefit the people who need it. And so, yeah, now maybe to the next slide. So, and with this, so Anita mentioned already that right now, 60 young people, parents, healthcare professionals are right now discussing and also training on how to bring together expertise, knowledge, best practices from the different countries within our project EU CAIAS-Net to develop the European network of youth cancer survivors. And this is, so we know that facilitating knowledge sharing and mapping initiatives that are going on these topics that are so relevant for the affected young people, quality of life, AYA care, EDI, is so crucial. And I would like to all encourage you to go to our platform, beatcancer.eu, and you can maybe go to the next slide, please. Scan here the QR code, then it will be faster, and engage with the young people there. We have here an interactive virtual platform where so many young people, survivors, parents have already registered and are sharing their concerns, what's bothering them, their challenges, but also solutions. And we really want to bring together all the stakeholders. So if you're interested in getting in touch with these young people across Europe, then go there, join our platform, and start joining the dialogue, because this is where it will happen. And yeah, let's collaborate and implement what we are working on. Thank you.
Thank you, Karina. That was fantastic. Just interests me that when we talk about youth cancer survivors, we get QR codes and social media. It just makes me feel very old. We need to get with the young people. I just want to say welcome everybody in the room, but also welcome to everybody online. I hope you're hearing us well. We've got 50 people dialed in online, and I think the numbers are still going up. So welcome everybody. I hope we'll hear from you at the Q&A session. So now it's my pleasure to introduce another video talk. Unfortunately, Patricia Toya couldn't be with us today, but she's kindly sent a video message. Patricia is an MEP in Italy, and again, an amazing champion for the issues of childhood cancer for many years. And Patricia is currently the co-chair of the European Parliament Research Committee and was a substitute member of the Beating Cancer Committee. And she sent a message for us to listen to today. You run the video, please.
Good afternoon, everyone. I am honored to have the chance to address you once again on International Childhood Cancer Day, an annual event that I hold very close to my heart. I would like to thank SIOP and particularly President Rizzari for inviting me, and for, above all, for its long-standing efforts in keeping this issue high on the European agenda. Cancer is a word never pronounced with a light heart, and even more when it affects the most vulnerable, our children. It's about stories of incredible pain for the young patients who bear a burden beyond their comprehension, and for their families, try to find the strength when it is most difficult to gather. While cancer remains the #1 cause of death in children over the age of 1, there is another figure that gives us a glimpse of hope. There are about 500,000 childhood cancer survivors in Europe, and the trend is likely to increase by 2030. The choice of dedicating this year's event to childhood cancer survivorship is therefore a most commendable one. We have to recognize that surviving this evil disease is often not the end of the road, but the beginning of the longer lifelong battle. In fact, at the time where Europe is preparing to invest a significant amount of money in cancer research, we must ensure that enough is earmarked of pediatric research. Developing age-appropriate treatment it's crucial not only for increasing the survival rate, but also to improve the survivors' quality of life. We now also need to put in place a strategy dealing with the social consequences of childhood cancer and its effect later in life, mainly on education, employment, working capabilities and income. The European Parliament has been working with these goals in mind, particularly within the special committee, you know very well, the special committee on cancer, BECA, to which you provide precious guidance. We sit at an important policy turning point where we now have a real opportunity to promote transformational change for these young patients. One of them is certainly in the new European Beating Cancer Plan, in synergy with Horizon Europe and the new program EU for Health. In the programming period 2021 and 2027, in fact, cancer research has now its dedicated stream under the Horizon Europe Cancer Mission, you know very well, allocated about 380 million euros to support implementation in its first 3 years. I also welcome the announcement in the recent Commission Work Programme 2023 to allocate almost 37 million euros to projects aiming at a better treatment and care intervention in children and adolescents, and another 6 million to identify best practices to improve the quality of life for childhood cancer patients, survivors and their families. We cannot forget that a comprehensive response must include the long-awaited revision of the pediatric regulation and the orphan regulation, which will hopefully start in the first quarter of this year. The Parliament has raised the point multiple times. Urgent work is needed to improve the condition for studying and authorizing new cancer medicine for pediatric use. We cannot wait any further. Lastly, I would like to mention that in ITRE, my commission, we will begin working on the opinion to the new proposal for EU health data space, which has the potential to empower patients and offer huge benefits in cost savings, research and innovation. In fact, we will need to employ a generational lens to seize the opportunity of delivering legislation that responds to the real needs of children and enable the potential of innovative digital and AI tools. I look forward to receiving your inputs and remarks on this important piece of legislation for health. To sum up, Having a comprehensive strategy on cancer at a European level is a huge step forward. Yet, we always have to recognize, this is my continuous attention, to recognize the peculiarity of challenges related to childhood cancer in order to avoid the risk. There is this risk. You have to avoid that risk of setting aside or underfinance the pediatric dimension of oncology research and innovation. This is our unique chance in Europe to do better for our children and respond to the calls for a union that is closer to needs of family and societies. We must act now with determination and without hesitation. We owe it to our children. Thank you again for your commitment and my best wishes for a successful event.
Excellent. So we've heard from MEP Toya the importance of research and innovation in survivorship. So what we're going to hear now is what are the research priorities for childhood cancer survivorship. So it's my huge pleasure to start again by introducing Katrine Scheinemann. I'm not going to go through the full introduction again, and then she will hand over to Nicole Scobie after her presentation. Katrine.
Thank you very much, Pam, and I apologize, but survivorship care and research are so closely connected, so I'm stepping in for both roles. So that looks like a really busy slide, but what I would like to show you here are different dimensions of what survivorship research means, because there are different aspects we have to cover. There are patient factors, which we can do research on. There are a lot of factors about the cancer itself. But then there are aspects about providers and also healthcare system. And these are maybe just only the 4 big ones, but there are many more, like really to look into it. So what maybe have we covered already or have some answers? And what we have done really at the beginning, we're just like collecting clinical data from the first survivors and doing this over years and years and years. So we can say now we have followed up some for decades. So we have data from now patients who have been treated 40, 50 years ago. And this is really on an institutional level, but also on a national level or an international level. In Europe, we have pulled our cohorts together. So we know a little bit like how long-term survival looks out, but please keep in mind, these are survivors treated within the first protocols. And sure, the long-term sequelae will look different than today. That's at least what we hope, because we adapted treatment. So we have looked into what are the long-term sequelae, also what are the causes of death, and when did death occur? Did it occur at the so-called normal age, or was it earlier? And what does it mean? So I think we have a rich body just on like the treatment modalities we know, which is surgery, but there has been a big improvement on radiotherapy. You all know there has been a big improvement, photons, protons, and on chemotherapy. We have spent a lot of like research work into evidence-based guidelines on follow-up, which we have, and it's also not only a European effort, but it's an international effort that we are all doing the same. There is an international group, we are working together, and all of these guidelines are really have to look up, and like each 5 years, we have to look over this because maybe there is new evidence out. We have done a lot of research on models of care for survivorship, because there can be huge differences depending on the setup of your institution and your country. And there is not one model which fits it all. Sometimes you have, especially if you're looking at the transition from pediatric to adults, yeah, maybe you have a big comprehensive cancer center and have the adult oncologist who are taking care of this, or internal medicine. Or you have to go outside of the hospital setting, find there an oncologist or even a GP taking care of this. And that's really depending on the country. There are different models out there how to do a treatment summary. And we talked a lot about digital. We are there, it's not a completely fit. And as you can see, there is a lot of work behind this, and also then built-in algorithm that's automatically, okay, you have this drug, this dose, then you know which guidelines you have to follow. And I think the most important things we learned already, what we have learned, we try to implement this in upfront trials. Not to sabotage really the overall survival, but to make survival better. Can we maybe not go up to a certain cumulative dose and then to minimize late effects? What is about radiation? Or can we do like minimize the surgery or just do a two-step surgery? And that's already reality today. This list is not complete. These are just like a few things I would like to highlight. Next slide, please. So where do I think could we still have gaps? Risk models. What do I mean by that? Now we have started to see everyone maybe yearly for lifelong. But that's maybe truly too much for certain risk groups who have not received like a lot of treatment. And maybe there is at some point the time we can say after 10 or 15 years, yeah, it's safe not to do specific long-term follow-up any longer. One big thing where we really try to, can we like really implement interventions to either minimize long-term side effects, and I'm talking about physical activity, lifetime changes, medication, or would it be even, could we find something to prevent long-term sequelae at all? I mean, that would be the perfect thing. So we can give something during the active treatment that they will not come. I already highlighted a little bit, and that's really important for us. And we try to implement this just right now through Accelerate. What are we doing with all the novel therapies? And it's not just extrapolate from the adult world where there have been like introduced way longer. We have to do this, and we have to do this in really clever way, prospective. So we have to collect data, but also translate them to really see what we're getting out. We have huge areas, and Karina has mentioned them, where we have not done such a good job so far, covering like really areas like mental health, psychosocial outcomes, fertility issues, vocational outcomes, insurance issues, independent living. So this list can go on forever and forever. So there we really have to stronger focus on and find like really, it's not only doing research, but translate this directly into care. Because I think we cannot only do research and acknowledge there is a gap, but there is something, but what can we do to overcome this? And my last point, and I think that's the most important one, we need really a stronger involvement of survivors and families and work on all of this together. We can't do this alone as the healthcare community. We all have to work together also to set priorities. And I think there is a lot of ongoing. You have seen some of that, and we will keep discussing and are really collaborating really closely. And with this, thank you for your attention, and I'm handing over to Nicole.
Hello, everyone. Thank you for inviting me here today. I am the parent of a child who had cancer when he was 4 years old, and he's now 16 years old, so he's a survivor. And I was asked today to talk about the subject of research when we talk about survivorship. I'm, as a patient advocate, very involved in the subject of research in different levels, new drug development, but also this subject of survivorship. And in preparing this presentation, I only have 2 slides, by the way, so it's not too long. I thought a lot about the word research and what the word research means to people, because it actually means something different depending on your perspective and depending on the issue that you're talking about. Could I have my first slide? Thank you. So I broke it down into 4 categories of what patient advocates, so both parents and survivors, are expecting, hoping, what our needs and expectations are when we talk about research into survivorship. The first, oh, no, you can stay back on the first slide. The first one is for regarding today's survivors. So the survivors that are there today, what do they need when we talk about research? And for well, Katrin touched on a bit of these subjects, but we need to help them. We need to develop effective therapies for survivors of today. They have issues today they need help with, and we need to research into what kind of therapies we might be able to help to overcome some of the side effects that they've had from their treatment. There's also the psychosocial research that is lacking or that needs more work on, that Katrin also touched on, that we really need to do a better job of working on that, on doing research into it, on trying to figure out also what are the psychosocial effects that survivors today are encountering, and maybe there's a link with the treatment they had or there's not, and what is the effect of that. That's all research also. Then the second one was today's therapies. So children getting treatments today, what do they need in terms of research? They have issues that are happening because of the treatments today, chemotherapy, radiotherapy, surgery, and we need to do research into how to help minimize the impact of those therapies. So not just know what will happen, but also, is there something we can do about what will happen? And I gave as the example of fertility preservation, because this is relatively new, that now, as many of you know, many children will have fertility issues as a result of their cancer treatment. And there are fertility preservation techniques that children can now have before their cancer treatment, even very young, like prepubescent children. But it's, of course, experimental, because it's research, because it's not proven yet. And part of that is because most of those children haven't grown up and yet had the opportunity to see if they can have children. So this is research. So for that, we need to be working on this now so that future children can have, potentially can have this type of treatment. And then the third one is regarding the new treatments, new innovative therapies. Katrin touched on this as well. It's really important to patient advocates that we start now for all those new therapies that are coming out, like CAR T cells, immunotherapy, precision medicine. Some of these treatments, when we talk about precision medicine, children will be on for potentially a very, very long time. And we want, as patient advocates, we really want the research into the survivorship to start right away. Start with the developing of the trial right away so that we can follow this, we can learn from it, and even potentially, once we have enough knowledge, impact the treatment as it happens. So monitor it and then learn from it in order to have an impact in the future. And the last thing is, survivors and parents want access to information. We want to know what research is happening. We want to know what the results of the research are. Karina talked about access to treatment, and it's also important to have access to that information of what's out there. And survivors also want to know, and parents also want to know, what are the results of any research they've participated in. It's important to us, since our child was in it or a survivor went through treatment, to know what was the result? What was my contribution to research? That's important. And then my last slide, I tried to summarize, if you can go to the next one. Yes, thank you. I tried to summarize all of these thoughts into one sentence. It didn't work. It's 2 sentences and it's very long, but that's basically the summary, is research into survivorship. So this is research into survivorship should be implemented directly into all clinical trials and therapies so that current patients are monitored and followed. Their survivorship path is part of the treatment plan, and also so that they have access to information, but also so that the knowledge gathered from their experience becomes part of what informs treatments for cancer, as well as for survivorship in the future. So today's survivors and then the future patients. Thank you.
Thank you to Katrine and Nicole. So you've had a lot of scene setting, and now it's our chance to have more of a discussion. And so with that, I'd like to invite the panel members if you come and join me up on the stage. The way this next session is going to run is I'll introduce all the panel, and then they will make some statements, and then we'll have some discussion. But that's your opportunity to start asking your questions, to start thinking of them now. And all of those of you online will be collecting your questions as well and posing them to the panel. So if I could invite the panel members to come up, please. Excellent, we've got everybody, and the microphones are working, so a good start. Okay, so So you've got everybody's bios in detail, so I'm not going to do a long introduction of everybody, but just to orientate you, at the far end here we have Alexandra Moretti, you're very welcome, MEP from Italy. Unfortunately, you'll see that we did have Nikolai Stefanutu. Unfortunately, he's unwell and isn't able to join us today. But I'm pleased that we have from the Commission Philippe Roux, Head of Unit at DG Sante, and also from the Commission, Annika Nowak, who's Head of Sector at DG Research and Innovation. And then I'm delighted to introduce from the EMA Dominic Carres, who's the Scientific Officer for Pediatric Medicines. And then turning the other way, have I separated the EMA and industry? Is this a good place to be? Or maybe a dangerous place to be, I don't know. But I'm delighted to introduce Stergios Zacharoulis, a long friend and Senior Director, I should say, for Pediatric Oncology at BMS. And then you've already met our ladies at the end, Katrine Scheinemann, Karina and Nicole. So with that, I'd like to start to invite Alexandra to make your opening statement, please.
Sorry. Hello to everyone, and thank you for inviting me today and giving me the opportunity to discuss with you about this important topic. As you know very well, cancer is the second leading cause of death in Europe after cardiovascular diseases and accounts for 26% of all deaths. EU countries spend each year significant amount of money on cancer treatments. Therefore, we can easily see the many implications of this disease on different levels, from a strictly health-related point of view to the socio-economic one. The EU has acted concretely to address this public health issue with the launch of the first European plan to fight cancer. The report approved by the European Parliament in 2022 was very ambitious, also in the area of childhood cancer, and is currently being implemented. So here my colleague we work together a lot on this. I will try to be very brief and send two main messages before the discussion with you. Two aspects in particular are very important to me. Address challenges related to treatment, address challenges related to cancer survivors. On the first aspect, treatment. We know that one of the key aspects in the fight against cancer, and in particular for pediatric cancer, is research funding. There are common challenges all across cancer research, but some of them are specific to childhood patients. Although 1/5 of childhood deaths are caused by cancers, pediatric cancer cases are just a tiny portion of the overall global cancer burden. Therefore, research and clinical trials are generally underrepresented. I think the EU should firstly engage and address this issue. For example, for ESA reinforce specific EU funding stream dedicated to pediatric cancer in our funding programs. But also, for example, by linking EU budget allocations across all relevant EU programs. Unfortunately, of the 150 cancer drugs developed in the last decade, only 9 have been approved for children. We need to make sure that EU funding in the field of childhood cancer is adequate and forward-looking in the next decades. The second aspect concerns life after cancer. Nowadays, thanks to the scientific community, cancer can be cured. And this is even more true for children, where survival rates are higher than in adults. This means that many children have to be supported in their return to a normal life after treatments. They need to be supported while getting back to school, with dedicated programs to be guaranteed to all cancer survivors, but also their rights as citizens must be protected, mainly by ensuring the right to be forgotten. We have some good examples and best practices in Europe of legislations on the right to be forgotten, but unfortunately, this is not valid for all EU citizens. One of the main commitments I believe we should make is to have the right to be forgotten guaranteed all across the EU as soon as possible. We have asked all of this in the report approved by the Parliament, but we will also need your support and your convincing to make sure that member states take up on these proposals and protect the right of every cancer patient and survivor, in particular children. This was my 2 messages for the debate, but I'm ready to discuss to you and with you further. Thank you.
Thank you very much. Alessandra, could I just come back to you briefly? The Becker report, which you know has been adopted, it spotlights children and AYA, but can you maybe give some specificities on how the EU can really ensure follow-up actions in this regard?
Yes, thank you for your question. As I said before, we need to proceed as soon as possible with the implementation of the cancer plan. I mentioned the need to guarantee a proper level of funding of research and innovation in the field of pediatric oncology. We also need to orient both private and public investments toward the most neglected portions of population. I'm of course thinking about childhood oncology, but also others like, for example, the elderly or women. But your question gives me the opportunity to open up the debate. Because I am convinced that oncology should not be treated as a separate entity from the broader debate that we are having about the European Health Union. This is a major political opportunity to change the approach Europe has toward health. Unfortunately, Europeans currently experience huge discriminations in the access to public healthcare services, affecting them also while dealing with cancer. From screening schemes to treatment and innovative therapies, children are all around Europe pay the price of healthcare services that are just not up to the challenge. Depending on the country you are born in, your life expectancy and your chances of survival to cancer are very different. I believe that together with the implementation of the European Beating Cancer Plan, we must also proceed quickly to the creation of a genuine health union in Europe, with equal rights in the access to cancer screening programs and treatment, but also with the binding minimum standards for healthcare services in each member state.
Thank you. I think the point of the addressing the inequalities in this world is very well received by this audience, and we'll probably come back to some questions around that. But if I could now turn to Philippe Roux, if you can make some comments from the perspective of DG Santé.
Well, thank you very much for the opportunity you give me for being with you today. I think I would want first to, yes, I have difficulties with mics, I'm sorry. I'm most often behind the scene and not on the front scene, on the making, which actually is important to you, I understand. Also, I wanted to resonate with what MEP Francine said in the role of the Parliament, because indeed, I think not everybody knows, but in fact, action on public health, on health, started at EU level by cancer almost 30 years ago. So we have made progresses. There is still a lot to do, and indeed, I hope the plan can help that. For me, the very important element is what was said also earlier, is that we observed a highest rate of survival among the children and affected by cancer. And that gives also already to me a take-home message, which is we need also now to focus on a better life after cancer. And I think that's for me the first take-home message, because what I wanted to say is I'm here more to learn and to hear and to see how we can better serve with indeed the plan, because the plan is not more, but not less than a tool that is for us an opportunity to make changes. And we have identified, I think, thanks to your organizations, but a number of other stakeholders, 5 strands of fields in which we can develop actions, concrete actions. The first one for me is focusing on communication and networking. I think that's core. It was said before already by others. It is very clear that sharing information among the community of cancer survivors is essential. And from the Commission perspective, so to make it concrete, we already started by founding 2 projects. The first will be easy for me because it was already introduced earlier. It's the EU network of youth cancer survivors. And that was mentioned by Karina Schneider, so I will not elaborate about it, and it's an important initiative. A second one I wanted to mention is the Outdoor Against Cancer Contact Us project, which started also last year in June. And its goal is to train young cancer survivors and their family to become ambassadors and coaches in each participating country. The idea is really to help each other, so peer support, which is to me an excellent idea and a best tool to avoid isolation. And I think here there is something promising. But again, what was said also, which is very important to us, is they are projects. And sustainability is important. So from the kickoff, it needs then to fly on its own, and that's very important. I wanted to say it now because I will forget after, and I thought that's very important because we can only develop projects at the point. Of course, on communication, there are a number of other elements. The only one I will mention, because it was already mentioned, but we believe it's an important one, is the Cancer Survivor Smart Card, which I will translate into a mobile application, and that will be in support to cancer survivors and their relatives, and also facilitate contact with their carers and with all services and people that can be in support to them. This was, of course, financed by the program, by the EU Health for Health program. And what is important for me is that it is a co-creation approach that is envisaged here, and it's led by the European Cancer Organization that you certainly well know, and a number of stakeholders are involved, and I think this is certainly one of the key of a potential success. So the second, because I need to be fast, it's on data collection, and here the only thing which I can mention, to be very short, is that we are working very closely with the Joint Research Center with the development of a new dedicated section on childhood cancer on the European Cancer Information System. And I invite you, if you not have done it, look, because that's concrete and that it exists now already. On inequalities. An important issue that was mentioned several times already today, and I concur that it is one. And actually, the Commission, we have been very concrete. We worked on what we call the Cancer Inequality Registry process. And I think that's a very concrete tool. By mean, we have there the classical tool, which is a data tool where everyone can access information, but we also have national reports, the first of which was published for each of the EU member states last week at a launch event with our commissioner and under the Swedish presidency at an event there in Stockholm. I think this will be these elements will be instrumental, and in particular the national reports, because they provide detailed information focusing on situations and specificity of each country. And I really invite you to look at them and to use them, and also to feedback to us to see whether they meet your interests and your needs, and how we can improve. Because as many of the things in the Cancer Action Plan, we have been on the motto of start fast and improve. So here improving is still very important. Training of workforce, only one left, so you're nearly at the end of my marathon. Yeah, also we consider that it's an important element. I mean, and we have already in the EU for Health program 2023 included a call for proposal for the development and implementation. And I say implementation because it's not only develop, but also implement the second cohort of the interdisciplinary specialty training on cancer. So that's for us a very important, because the idea is really to offer training opportunities to a large number of actors that are involved in the work. Yeah. I'm taking my notes because I don't want to forget anything. So last but not least for me, it is the holistic approach. And I think here it's an holistic approach, not only in terms of who are on the ground, the actors that are involved, from the children themselves to the parents, up to at the other end of the chain, the researchers. So all are important to be involved and try to work all together, which is not an easy task, I would say. It's not easy to do, but it's a necessity. And I think in here we have had a number of actions, and I think, for instance, the recourse or the work together with the European reference networks will certainly be an important element. And there are so many initiatives. It's difficult to mention them all. There is there is, for instance, the imaging initiative that was also launched not long ago, which certainly will help recognizing cancer at an earlier stage and reduce pain and help indeed making a big progress fast. Of course, my colleague will tell you of all the development in DG research, but there is also the EU Health data space. And I think, to finish, the only message, as I said, which I will carry home, if there is one, is that indeed the importance, and I think it's Toya who mentioned that, and also Karina, I think at one point, what is important is survivor's quality of life. And I think a focus on that also is needed, because that's also forgotten for long. We thought, well, what is important is to find treatment and save people, and not much thought was given on the survival pain, and that is something certainly we will try to also support and facilitate initiative in that direction. Thank you. I was very long. I'm afraid.
Thank you very much, Philippe. And for some, you say that you are in the background, but actually some really important and wide-ranging comments there. Thank you very much indeed. So now I'd like to turn to Annika to hear the perspectives from DG Research and Innovation.
Yes, thank you. And I can enlarge the list, what we do at UE11. But I think what is important to understand, yes, there are two parallel initiatives, and there's a long story how this all has started. But the most important is it is really complementary, and that's not so given as one would imagine. I mean, now with us sitting here, we work hand in hand, and that's almost on a daily basis that I am in contact with my team, with the cancer team in DG Santé. And I think this already is a good development. When it comes to research, and I saw, I mean, the long list and the needs, and just still very fresh, we had workshops with young cancer survivors already in January, and then yes, this Monday, and the conference yesterday has brought, I mean, a lot of very interesting experience that these young people shared with us. And I think the difference really for us was, I mean, it's not that obvious in the Commission, we engage directly with the citizens. And this is one of the new characteristics that the mission brings in, that they should help us to shape the initiatives and to implement them. So listening to them, but really also taking this forward. So different means we have, I mean, there's the Cancer Mission Board. I see that we have Rob Peters here as one of the members of the new board, but also Ruth Landstein, she was a member of the previous board. So the discussions with the member states, I mean, this is also where we can now play a stronger role. And then obviously with all the MEPs now here in the room, but also with the BECA report, I think there is a strong alliance, and we have to push that also in the area of research. So what I want to highlight, I mean, obviously over the past 30 years, many successful projects had been funded to better understand cancer, but also in the area of better treatments. And I think now also with the mission on cancer, we want to shift more the focus also on survivorship. I mean, not just with a conference. I mean, that's always nice, but that's not obviously enough. We have already launched some funding, and I noticed, yes, it's never enough, but at EU level, even though it's a focus now, it's a priority, this funding won't be enough. So we need the member states' national funding, we need the industry obviously on board. And what we hope is the mission that we drive and develop a kind of strategic agenda also in terms of research, that we hopefully align also a bit this funding and the prioritization towards, you know, where to put the funding, where are still the gaps. So it's still very much the beginning. The mission was launched only 1.5 years ago. Since then, we have launched or published 3 working programs. That was quite a marathon because we had to kind of catch up. But at least, I mean, if it becomes to survivorship, 70 million seems not much, but I mean, this has been launched. One of the actions is to develop and then also validate the quality of life measures for cancer patients and survivors. So that's for all, so to say, but it will obviously also help in the area of childhood cancer. And what we are also trying with the codes is not that, you know, project running for 4 years and then let's see when we get the results, but some of these really have a precise timeline. We want to have quick results. We have to have it validated. So once the project ends, we have something in our hands and then we can take it forward. I think this is also important to notice. And this was another call with the most recently adopted work program is on improving quality of life for survivors on childhood cancer. We're looking into more best practices and tools because there are already a lot of things which I think can, you know, scaled up. So this is open. We hope we got many good proposals. And also what is important to notice, there's a regional dimension. So we also look now into, you know, where we can get the regions on board. Another, I think, major actions notice, well, should be mentioned is what we call the European Cancer Patient Digital Center. That was one of the recommendations from the Cancer Mission Board, the first board. And also in the discussions with the young survivors, many pointed to that. I couldn't find the right information on treatment options, on side effects. Information wasn't available or it wasn't given to me. So how we can improve that? And I think we're still just launched that action in the sense we need to have a, you know, a concept. So we launched a study. How could such a center look like? Not just a website, yet another one. So it's really then to enable patients and survivors to have access also to their own clinical data. So the smart card should also play a role in that or should be part of such a center. They can share the data with healthcare providers, but they should obviously get out of, you know, the information they're looking for on treatment, on side effects, you know, measuring their outcomes and so on. The stages, we have launched a study. That's where we have to start with. But we should get the results in 8 months. And that's the point where we want to discuss then it with the stakeholders, you know, is that the concept? Is that something which really serves them the purpose before we then really create such a center? And the center is also part of the cancer plan. There are also other projects that's more in the area of understanding, but I don't want to go into that because we want to focus on survivorship. Another project which has started last year is what we call the Uncanny EU. That should be and will be a data platform. Not just cancer data. We really want to have a very comprehensive set of data. It should facilitate the research, but then also obviously in the area of survivorship. I mentioned the close collaboration with the cancer plan. It's not just because we are sitting here and saying so. All what we put in terms of research should serve policy. So really evidence policy. Again, should be systematically done. But I think doing it at EU level, we hope that inspires also then the member states, the national funding, the private funding. And that's also, we are looking now more and more to build these synergies because even Horizon Europe funding is limited for cancer. So we have to have the other funding to implement all the actions we have included under both instruments. So briefly mentioned, there's what we call a joint government. So when we talk to member states, it means DG Santé, RTD, side by side, in the same meeting with health and research ministries. And this is something we're doing since 2 years already. And that's, I think, still it's a novelty that you bring these two policy areas together to have discussions on, you know, research actions, policy actions, and always the link between the two. Then very briefly, the workshop and the conference yesterday, even, yes, we are doing conferences. This is a different format. It's a different format in the sense it was the survivors we engaged with. It wasn't easy to get these survivors. I mean, in the sense to connect to those. We went through, you know, the organizations, and that was a great help. And we also teamed up with WHO. We had the first round, as I said, the second round, and this week and the conference, and they were really in the center of all our activities. And the feedback we got was so positive. I mean, it was really moving, the stories they shared, but really they could point us, you know, what would serve their needs. And now, after this morning we had with the team, we're saying, oh, well, this and this and this we have to do. So now we have to reflect, we will take it forward. And this should now drive also, you know, the research activities. We will soon then, you know, start developing the next work program and impact. I hope we will reflect what we have learned from these workshops. So thank you.
Thank you very much, Annika. And now I'm going to turn to Dominic for the perspective from the European Medicines Agency.
Thank you very much, and thanks for the kind invitation. I hope I can match my previous sort of speakers, but it's really great to hear. I think, you know, how all the initiatives, you know, related to child cancer survivorship sort of, you know, bridges from really, you know, starting from the research and development phase to long-term survivorship. And I'll try to sort of give you a perspective looking at the European Medicines Agency's mandate, which is obviously to regulate medicines. And here, you know, clearly our key objective is and maintains to foster innovation, so that all patients across Europe have access to authorized, safe and efficacious medicines without an unnecessary delay. And here, really novel agents which improve survival and quality of life. And that's, you know, strongly embedded in the agency's general objectives, such as and seen in initiatives such as ACT-EU, Accelerate EU, the sort of initiative done by together by the European Commission and the heads of medicines agencies to accelerate clinical trials and access to novel agents within clinical trials across Europe. Now, with our sort of focus mandated through the pediatric regulation on the research and development space, we have sort of identified three key pillars, if you wish, which we consider really important when it comes to implementation of the overarching objective, as we've heard so far today. And I'll really, where we believe this is, you know, very important, if not almost fundamental, to success in that regard, and really making more and better treatment options available for patients with cancer and pediatric patients with cancer across Europe. And I'll go through the three pillars very quickly, conscious of time. The first pillar is really building on and strengthening multi-stakeholder engagement. And I'm sure you're aware of the concept, but why is this? Because we need to prioritize development efforts. Really, there's a need to identify which products are really able to address unmet medical needs and should reach patients without delay within the clinical trial, and then subsequently through an authorized product. And we as regulators, we cannot do that. We can't prioritize, but academia, patient, parents, together with industry can, and the Pediatric Quality Strategy Forums, which you're very well aware of, organized by Accelerate in collaboration with the EMA and participation of the US FDA, our US counterpart, have shown that this is really possible, and you know, such forums can inform our decision making at the EMA. But we need to further strengthen that and build on the current success, making it really fit for the future. The second pillar is on strengthening international regulatory cooperation and collaboration. Why is this? Because I think although we're discussing the European focus right now, I think we all agree that pediatric oncology development and survivorship is essentially a global endeavor and something which, given the rarity of the disease, one has to approach on a global with the global perspective. In addition, beyond in Europe and in the US, there are also regulatory requirements in place. So to enable global developments, we need to work together in that regard. And we've done that in the past and developed strong relationships. We've called for simultaneous submissions of development applications. We've published common commentaries where we sort of outline development expectations. And through that, we have sort of identified our monthly interactions with regulators, not only from the US, but also Health Canada, Japan, and Australia. So really, I think an important pillar not to forget. And we need to now, develop this more, these interactions in a more systematic way. So that really no product and no sort of development issue for certain development efforts slip through the net, if you wish. And the last key pillar is not less important. To the contrary, probably is on capacity building. This sounds very sort of broad and unclear, maybe. I'll give you two examples. What do I mean with capacity building? The first is I mentioned earlier that we need to prioritize, which then also means that potential change means that there are potential changes in priorities as more evidence comes to light or unmet needs change over time. And this needs that we as regulators need to ensure that our decision making governed through the pediatric regulation as is, facilitates that and is not sort of blocking that, but continues to be an enabler in that regard. So our outcome documents, our pediatric investigations plans, they need to be fit for purpose, allowing for flexibility on one hand, while ensuring that a development path forward targets an indication of high unmet need based on robust data and essentially allowing that data set to be reviewed for its benefit risk, which is exactly what the regulation sort of mandates. In that regard, we have published our current practice just recently on how we approach this, which is not an ambition. This is really a reality. But of course, we need to learn from this now. We need to formalize it. We need to learn as we move forward and adjust as needed, obviously. And the second element to this capacity building, and that's very close to my heart, actually relates to education. And we have heard about that already. We need to educate all the respective stakeholders on the specificities when it comes to pediatric oncology drug development. We need to learn from and with each other. And this includes clearly, patients and survivors. And we've heard that from Nicole, because I think their experience is really key for us. Helping us to inform priorities and decision making. And with this in mind, we're collaborating partner in the Aladdin project, and I'm sure you've also heard about that. I think it was presented yesterday at the European Commission's Young Cancer Survivors Conference, really reinforcing the importance of education in that regard. I'm personally very excited about this. Before handing back over to you, I think it's important that successful collaboration within these three pillars, if you wish, and that's what I would like to sort of get across very generally is I think only possible and dependent on each individual stakeholder taking up his or her responsibility. I think otherwise we can have more of these conversations and nothing would change. Thank you.
Thank you very much, Dominic. Again, I've got a long list of questions on my piece of paper. I'm hoping you've got lots of questions on your piece of paper over there. But before we get there, I'm going to hand over to Sturgis to hear from the industry perspective.
Yeah, thank you so much again for the kind invitation. It's a pleasure to be here. I'm a pediatric oncologist and for the past year I have been in the industry, so I can give a perspective from the industry point of view. So first of all, starting as a comment to the health authority representative, the EMA, my dear friend Dom, it is very apparent that the health authority is doing an amazing job in terms of mandating long-term follow-up and safety data for all the new agents that are used in pediatric cancer, and this is very welcome. The safety and the long-term safety is a fundamental aspect of drug development. Is not only the ethical obvious reasons, but also essential for the sustainability of any industry which develops drugs. So there are several aspects within the industry and processes that highlight the interdependencies, and I will summarize a bit of some of the challenges and perhaps a positive outlook moving forward. The first process has to do with the internal process of pharmacovigilance for long-term safety for new agents that have been developed. This process is dependent on the providers in the community to feed back with adverse reactions, with side effects that are being observed after even the drug has been authorized. That means, however, that the physician, the healthcare provider needs to be aware of what needs to be reported and be aware of the process. So this also means that there is a need for the healthcare system to be in place where this process is maintained. For example, from the transition that we mentioned earlier from the pediatrician to the internist, or to the pediatric oncologist to the medical oncologist, etc. So there is one potential significant room of improvement in that regard in terms of educating the colleagues in the community for this type of processes, because this is also related to updating the label of any approved medication, which is mandatory and has to include not only clinical trial data, but also data generated in the real world. So, and here is the big challenge now, which I think is essential to resolve from both the industry and from other aspects, is the quality of data. And what does this mean? It means that in order to have proper quality data to generate evidence or change practice or provide quality of survivorship, this requires a lot of work, not only from the industry point of view, but also from the processes that are being involved. And let me be a bit more detailed on that. For example, in order to have appropriate data, we need the gold standard, which are randomized clinical trials, which of course for long-term safety is practically impossible. But also, more importantly, we need long-term data, as in way beyond the 5 years we currently evaluate. This means, however, that the cost for the clinical trial, for such a trial to be implemented, is extremely high. So what is required in order to do that, in addition to the, as I said, to the mandate that is being applied from the health authorities, which again I said is welcome and very appropriate, is to have funding support for that, either internally or through government processes. Essential to the data quality is the development of registries across the world, with which are very active. As a perfect example of the Accelerate from Dr. Vassal and Professor Pearson, or the National Cancer Institute Childhood Cancer Data Initiative, which are working together, and plenty of others. These registers need to be supported by every stakeholder involved, including funding, including implementation, and acceleration of the implementation of the registries. There is the aspect finally of real world data, where I think moving on to the future, there is hope from the point of view that everybody recognizes with sensitivity there is a big gap. Recently in the United States, this past month, there was the STAR Act was reauthorized, meaning that there is a dedication of funding for significant budget to facilitate this type of research for long-term follow-up. So finally, I think this is a very complex problem that requires, as everybody mentioned, the multifunctional approach. But the reality is that for the implementation of these wonderful initiatives, we do need both healthcare system and social services that are aware of these issues, and because unfortunately without their practical implementation, this will not lead to anywhere. But moving forward in terms of a tone of optimism, I see the amazing efforts that have been done in Europe in terms of utilizing modern technology of artificial intelligence to overcome all these barriers. Similar to that, for the clinical trials, as we move forward, we hope that decentralization of trials using new technologies will hopefully diminish the budget and will make it more realistic to perform such studies. Thank you.
Thank you, Stergios. So, Katrine. Yes, I was just going to get a reaction from Katrine, but if you want to come in now, that would be fine. Yes.
Yes, my name is Rob Peters. I'm part of the SIOP Europe board and Chief Medical Officer of the Princess Maxima Center for Pediatric Oncology in Utrecht. I think what you said, and I want to comment actually on the 3 earlier speakers, or 4 even. I think it's true that it will ask extra money to start to monitor the late effects. I don't think there's extra money necessary from the governments or from the EU or from the institutes to the pharmaceutical industry. I think what we should do is reduce the number of monitoring issues and registration of, let me say, meaningless details in our current studies. And by sparing that, we can easily have this done without extra money. I think, and that's, I'm not blaming the pharmaceutical industry. It's a mix of pharmaceutical industry, of the regulators, of ourselves as pediatric oncologists, that we have drove ourselves crazy with registration, all kind of useless details, also on new drug studies that nobody cares about, not the patients, not the parents, not the survivors, not the oncologists. And if we would be willing to reduce that, it will make life and surviving life much easier. The question is, can you give an example? Well, in new drug studies, you have to register every small detail on toxicity, what is called toxicity, but which is not regarded as important both by parents, patients, and oncologists. So why are we doing this? Why do we spend this money to these things?
So thank you, Rob. I think it's an interesting statement. I think if I understand correctly, you're saying if we did less of the detail of regulation, the money would go further and it would spread it more thinly and go on longer. We are to some extent in that bound by the regulations. I am going to ask Dominic to comment, although he won't like me asking him to do that. And then maybe from a because as you say, the regulatory stuff is very much at the high end of the drug spectrum as to whether Stergios wants to come back. So Dominic.
Thanks. What the regulators and what we need to see when it comes to all the respective different steps of engaging with regulatory authorities when it comes to the products development's life cycle, whether it's the clinical trial application process or even the authorization step, is sufficient evidence and argumentations towards why certain things are not needed. The new clinical trial regulation very clearly allows a risk-based approach when it comes to data collection. So I think I fully agree with you. And that indeed, I think, means and requires sort of consolidated thinking towards what are products and protocols and situations where a more in-depth data generation is necessary to safeguard patients versus what are products development stages where this might not be necessary. I can give you an example. This is Mylotarg for AML. You know, this has been authorized based on a pivotal trial, to be very specific, an academic pivotal trial without any grade 1 to AEs collected. So I'm basically saying, and this is why I'm very grateful for the question, there is this possibility and there is this opportunity. Please come forward and discuss this.
Thank you. I'm just going to quickly check with Marco whether we have questions online.
Hello, can you hear me? Oh, good. We do have a couple of questions, but I'm not really sure. Are you willing to address them right now?
Just hold on to a second, just to let you know that we are, because we started late, we're not going to finish at 3. We're going to finish at about 3:10. So there's plenty of time for the questions. I just wanted to know if there were any online.
We do have a couple.
I do just want to quickly ask Katrine, Karina and Nicole to maybe respond. Katrina, specifically, what I was going to say to you, you've heard quite a very positive responses from the Commission, from the Parliament, and from the EMA and from industry. As a doctor working in survivorship, are you encouraged, or what still worries you?
I am absolutely encouraged. But I still think so that's great for the overarching framework, but I think we have to start on an institutional level. So if we want to really make an impact, it's good that you are all supporting this, but it also has to come from our own community to start this. And there I think it's also us as SIOP, as PenCare to make this push as well, and then working together. And also like to partner with patients and parents advocacy. So I think it's all positive, but all healthcare professionals have to hear it as well.
Okay, so we need to engage our community as well.
Absolutely, yeah.
Karina, a very similar question. You know, there's been a lot of really positive initiatives being driven forward and a lot of comments that patients' advocacy are very much at the heart of this. Anything still worrying you on this?
I think the same worries that I had before. So how are we going to get this on the ground to the member states? So I don't know if I'm also allowed to put questions out there. So how are we going to pull this off? So together with our MEPs, how are we going to interact between us to make this push, as also Katrin said right now, from bottom up and then top down? How are we going to do this?
This is a call to arms from everybody in every member state.
You heard it, yeah.
All these people have got fantastic ideas, but to help implement it at the member state level, which I think is what Alexandra was saying earlier.
Sorry, just an answer. Cancer. Can you hear me? No. Before going, because I have to come back, but there is my colleague here. I think that this is a very important question and is a very key point. How we can do better to open the dialogue, because we are speaking about that together, different levels, policymakers and doctors and pharmaceutical sector, you know, association, civil society. But we have to put on the ground our ideas And I think that this is why we are here together. And we respect the different positions, but I think that we have this important mission to do. And the goal is a common goal, you know. So in my position, but I think that I can speak for all MAP here that work on this important issue, that we are with you. There is no difference between us, but you have more experience than us. So we can speak and we can work together on this important topic. Thank you.
Thank you. I'm just looking around the room for any arms. Delphine and Cindy, you wanted to respond?
Very shortly, because we will have a new subcommittee on health. And that's the moment, I think, to table our report again, to evaluate and to see what steps we can take to move forward and all our promises.
Thank you. Delphine, would you like to introduce yourself and ask your question?
I have to introduce myself. I always forget. So I'm Delphine Heenan. I'm the CCI Europe representative for European Affairs. I wanted to raise a question about how to ensure that we progress in understanding long-term side effects, because it's not exactly a clinical trial that we would need, in the sense that it would be an interventional trial. It would be a registry trial, making sure that data are being collected in a rigorous fashion in every single country. And also, of course, making sure that we have long-term follow-up consultation for patients, which also means an issue of reimbursement, because these are very specific consultation. They take usually longer than a regular 20 minutes visit or appointment with a doctor. It takes a lot of preparation to welcome the patient and understand what he's been through or she has been through. And also, of course, taking a long time explaining what the possible side effects are, and then engaging in meaningful discussion. But then after the time that a doctor needs to put into that appointment, there is also the recording and registration of all the long-term side effects. And we do see that it's very difficult to have those trials or those initiatives funded, because it's not about innovation. It's about improving certainly the future, but it's not in a very exciting way. No one's going to get a Nobel Prize on long-term follow-up. It does feel that way anyway. So are there any initiatives at the European level where it could fit in terms of funding, you know, to have a very rigorous registry for long-term side effects?
Thanks, Delphine. Excellent question. So you're basically asking, how do we resource this important research? Drug development's sexy, people fund it, but not necessarily this kind of work. So I'm going to, Annika, I'm sorry to put this on you, but...
I mean, maybe I can quickly step in, sorry. So one way to do this, and I'm sorry, I have to bring the example of Switzerland, and I know we're not part of the EU. So we have solved this within our childhood cancer registry. So we committed all ourselves not only to do things on like really diagnosis, upfront treatment, but also the all long-term follow-up data. And that's now all like, it's a law in Switzerland. It's a cancer registration law, and at least the pediatric part, so until the age of 19, has committed to collect all long-term follow-up data. Yeah, but just for the registry, but not for the clinic. So we do this all on our own. Exactly.
Yes and no. I mean, thanks for the question. And I mean, what I can clearly say, under the mission, we haven't done anything on that respect, but it's one of the main demands or suggestions we got now through our recent engagement with the young survivors. But I think that's exactly, you know, one of the areas where we have to look, you know, what is the side from the policy area to set up registries? There are, so I would hand over to Philip, but then also, you know, from the EMA side, yes, this is needed because of this and this. Yes, we can put more the research kind of actions, but we can also put it in terms of discussions with the member states, because at some point it's not just about the EU building all these registries, or maybe to join these registries. So that's then again more kind of policy related, but we don't want to do that divide anymore and saying, oh, no, it's not for us, so I hand over. This is something we, happily take up and then, discuss internally, but also, yes, yeah, we have the member states, then we have the stakeholders. So let's play it together and see, what's the take and how we can do it together. So that's not a real answer, but these are the questions which is sometimes difficult to say, yes, that's research. No, it's not just research, maybe this and this. So I think we have these almost daily talk, and I think that's the change we have now.
Yes, well, so you'll have the three of us, so you're very lucky. Perhaps in the room, someone said the solution is between too much or not enough. And I think what we have done in working not having silos anymore, as you just mentioned, we also have on board another department, which is the GRC. And we have been proud in us to ensure that GRC now is in the lead of, let's say, bringing together different registries, because the first thing to do is to know where the data is and which registry exists or which do not exist, and to ensure that they can communicate. Because that's we realize the most important is not to create new ones, but to see what already exists. You just mentioned that you have something that already exists, which may be not known. So the process that we put in place now is just easy. If you have an idea, either you send the idea to me or to my colleagues in the GRC, and we scrutinize what you are doing and we see whether that it is fit for purpose. I mean, in the sense, I'm sure what you're doing is very serious, but we also have a need to ensure that the data is solid enough so that it is not contradicted the day after it's put online or available to the research community and to all the stakeholders. So we have one entry point for that, and it's GRC. So what is different from the past is that we had different registries developed by different DGs. Now we try to ensure that this is all concentrate in the GRC. Not that everything is done there, but that at least they are aware of what is done, so that indeed we see that there is a value in a new one, or if it reached the quality standard needed.
Marco, do you want to pick out a question?
Definitely. So in the light of the unfortunate earthquake catastrophe that we have in Turkey, there's a question that appears to come in handy. So it is from our Turkish SIOP member, Nadan Tachildiz. He's the president of the Turkish Pediatric Oncology Group and also the principal investigator of the first national survivorship guideline in Turkey. And he's asking what could be the best way to establish best care survivorship plan in Turkey, a setting with a particular childhood population, including refugees and limited resources.
Not sure who is going to be able to answer that question, because unfortunately Alessandro has left. Cindy, I don't know if that's something you wanted to comment on, maybe later, or if you, yeah. Okay, well, so Cindy Francen, we'll come back to that question later. Uta's got a question in the room. Uta?
Yeah, I got a question, or maybe more as a remark, because I think long-term follow-up is a very important research topic also, because we have in our clinical trial groups our follow-up plans, but in fact, they are not at all evidence-based. Do we need a cardiac assessment every month, every year, every 5 years? We don't know, right? And as we are pediatricians, we are very careful. So I think we possibly do too much with these follow-up investigations after the time where we are still afraid that the disease may come back. So until the age of 18, while the patients are still in our hospital, we see them at least every year, which also puts a burden to the families and also to the adolescents and young adults who had cancer. This is the right to be forgotten. And therefore, I think it would be of an enormous, it's enormous importance that we really find out which drug does what harm to whom. Yeah, and in the PanCare Consortium, we try to find out in an enormous effort which drug and which dose makes the cancer survivors infertile. And there were tons of publications and none of them created any evidence. Yeah, and there's really a broad program needed to find out these things. And we challenged the families concerning fertility. Yeah, the reproductive physicians lobby to take ovary or whatever from a 5-year-old child, because they say maybe the child maybe become infertile and maybe then we have something for you, but maybe the treatment that the child will get will not make the child infertile. I think we need to know that.
So it's an important point, Uta, having the evidence base of what we do for the follow-up for survivorship. Nicole, did you want to comment?
I had a few comments, kind of some, from my notes. I wanted to come back to what Delphine mentioned about how, which is basically the question advocates always ask, which is how are we going to do this? What's the next step? And you talked about, or she talked about getting the data together and registries. We talked a lot about registries. And I just wanted to say for us, that's not enough having the data, because it's what you do with the data after and how that will inform treatment decisions for the future patients, and also how survivors today can now find help because of this data that we've collected. For example, for fertility issues, if we could have correct data that would tell us which kids needs it, does it work, at which point will it work? One of the things that really came up was working collaboratively, and I was very happy that both of you said you work collaboratively. And I think that's really important, because patient advocates were also, a lot of the time, we have charities that do funding, and one of the things that bothered us the most is when there's duplication of efforts. So it's really, really, really important that there's collaboration. You talked about some projects that really spoke to me. For example, developing quality of life measures for survivorship. And I wanted to mention that's something that you said it was for all cancers. And I think that it's important. Of course, I'm a childhood cancer advocate, but I think that you need to have a focus on childhood cancer as well within that, because I mean, my son was 4. Quality of life issues for a 4-year-old are different than for a 65-year-old, which doesn't mean it's more important or something's more important than the other, but it is different. And then the importance of multi-stakeholder collaboration that Dominique referred to, it's so crucial, and we are here. Marco, for Turkey, one of the things is get in touch with patient advocates. At least in that way, we could try to advocate. I don't know if they have a good network there. And when we talk about multi-stakeholder collaboration, Anika, you mentioned the conference you were at yesterday and how great it was that you had this exchange with survivors and with parents and advocates. And I just wanted to mention, now that you had that exchange, don't forget that they have expectations, and they're going to want you to come back to them with what's the next step, which comes back to what Delphine said in the beginning, throwing back what's the next step after this meeting, after we all leave.
Thank you. It's a fantastic moment on which to finish. Thank you, Nicole. I'm just going to say to Marco, I know you've got a lot of questions online. We could gather those questions and maybe we could pose them to the panel to put some written answers so we can respond to people, because obviously it's very nice that they've all dialed in online, so we get all that engagement. So with that, I'd like to say a big thank you to all the panel. I think that was a very lively and interesting discussion. And with that, I'm going to hand back over to Carmelo and to lead the closing remarks. Thank you all very much.
Thank you, Pam. Thank you to all the speakers and the panelists, because this has been really a lively discussion. And I have to say that I'm very happy and proud to be here and to have listened to all this. At least we have put some stones in the pond. So we are sure that there will be a follow-up after that. I will not take that much time because our host will conclude with her words. But I have heard all the key words about the, survivors. I don't like very much the term survivor, because it seems like, surviving after a nuclear bomb. But the war against cancer is not finished. And for children with cancer today treated in the last 20 years, there is still a life to go and a lot of problems to face. And I think that childhood cancer has been always reported as a successful story. Is sometimes a successful story, which still sometimes has to be written. And the children becoming adolescents and young adults and adults sometimes suffer. And we today have to understand why, and we have to avoid this for the future cancer patients and survivors again. So thank you very much for this excellent contributions, and I will hand over to Karina for some additional words. Anita, sorry.
It's okay. Thank you. It's a long day for all of us. Thank you very, very much. I was really seeing you all, and this is the first time after a very long time that we didn't see each other. And the most important thing for me today is that I really see the DG Santé and DG Research together. This is for us a very big achievement, and working with you, Annika, is really a privilege for us as well. We are happy that we could help you with not providing, but letting you know that we are there to support what we want to achieve in future. And we have heard what we have to, it's still missing. And I am very happy that you got a lot out of this conference, because it was a lot of work for you as well. So I think we are really there to thank you, and but also to convince you that we are there to support. You see, the community is very close, and we are there to make all these things happen, what we have heard today. Thank you very, very much.
Dear all, first, I would like to thank all the speakers for your interesting contributions. I can only say your messages have been well received. I already mentioned it briefly during the introduction, but the BECA resolution really sets out the way forward, together with your ideas and remarks today. The fact a lot of the priorities are mentioned in the report is thanks to organizations such as yours, who gave us very important input during our work in the BECA committee. Children, adolescents, and young adults need an age-specific care path. More investment in scientific research, specifically on childhood cancers, and easier cross-border clinical trials will give us new and better treatments. The current pediatric regulation has made a difference, but we have to do more. The upcoming revision of the legislation will be crucial this year. Every patient deserves multidisciplinary care and follow-up, certainly at a young age. Consequences of treatments have to be taken into account beforehand. Young patients need to be in contact with their peers, and long-term follow-up care is essential. A European-wide right to be forgotten will also help thousands of people all across the EU. Those were only a few of the priorities. Unfortunately, my time is limited today, but another takeaway from today is the ongoing need for cooperation. If we want to make the Beating Cancer Plan a success, we need to cooperate with all stakeholders, with patients, patient representatives, families, formal and informal caregivers, academics, and scientists. The importance of multi-stakeholder relations and consultation cannot be exaggerated. You don't make policies for patients, for their families and healthcare providers. No, you make policies with them. And next to this, a second necessity in the political will is the political will to make our goals a reality. We have a good plan in general, and the same can be said for our priorities on childhood and AYA cancer. But we need to make sure these become more than words on a paper. We need to keep pushing for action. I promise I will keep doing this together with our colleagues, shoulder by shoulder. I have been active in the fight against cancer throughout my political career, first in Belgium and now at European level. In the European Parliament, we had the BECA committee. We keep working on cancer in the ENVI committee, and in the future, we will have, as I already mentioned, a health subcommittee. This will enable us to keep the fight against cancer at the top of the political agenda for the years to come. And the topic of childhood and aya cancer survivorship is also a personal topic for me. My husband had cancer when he was young, and we have been faced with several of the different challenges we heard today. Several new positive diagnoses, the challenges faced at the bank and insurance when buying a house, returning to work after disease, fertility problems, mental issues. So I know from experience how important it is we make good policies, that we have good medical cooperation, and that we support families faced with cancer whenever and wherever we can. I believe my time is already up, but let me finish to thank everyone here today, the organization, all speakers, my fellow MEPs, and everyone in the audience. Although it is still very much early days, I would already like to invite you to the International Childhood Cancer Day event next year. Undoubtedly, this will again be a very interesting day. From my part, I can finish by saying again what an honor it has for me to host this event today. I look forward to working with all of you on the topic of childhood and aya cancers and the fight against cancer in general. Thank you very much.